This next video is, my shoulder feels like it's popping out of socket. So, the most common things we see in our practice are as follows. Rotator cuff pathology, meaning tendonitis or tears. Second most common would be arthritis in the shoulder where the joint's worn out. The third most common thing we would see in arthritis, and this is about a tie, is instability, meaning, the shoulder is this ball and socket joint that's got a huge arc of motion. It's wonderful. It's a really dynamic joint in the body and it can do amazing things when you think about it. But with that huge arc of motion, it comes with a cost or a caveat, and that it's prone to instability. And out of every joint in the human body, it's the one that has the most pathologic instability, meaning that the ball and socket joint, right? You have a little golf ball on a tee here. As you move it in space in certain positions, it can slip and not be stable. And so when you move your arm in certain areas, the shoulder will feel like it's going to slip out of socket. And for some patients, they perceive this. They feel like the shoulder's unstable, like they can actually feel it slipping. Some patients just perceive it as pain, right? They just perceive it as pain. And this tends to be on the younger spectrum. Patients really, I would say 45 and less, sometimes up to 50, but really 45 and less tend to be the people that get instability. And then when you get up into your 40s, 50s, 60s, it tends to be more rotator cuff tears and arthritis. So when I see a younger person come in their 20s, early 30s, it's almost always an instability problem. Not every time, but very commonly, I would say at least 80, 90%. And that instability is just the ball and socket is not tight enough. And some of that can be genetic. Some of that can be, environmental factors, injuries you've had, or just repetitive stress where you've caused some tears or stretching out of the labrum in the capsule of the shoulder. But either way, when you feel like your shoulder's slipping in and out, the issue is instability of the shoulder. And the way that we treat that initially is with physical therapy in some patients. Some patients require an operation in order to fix the problem. Who you are and what the deal is. I think the first step is just come in and see us and get evaluated, and we can tell you exactly what we think the problem is, and then move on to the next steps to get it fixed. Always the first rule in medicine is get the proper diagnosis or a correct diagnosis, and then we can start thinking about ways to solve the problem. But if you feel like your shoulder is slipping out on a regular basis or feel like it's popping out of the socket, that's something that should be addressed. And if your shoulder has come completely out of the socket, for sure, you want to come see us, because then we need to talk about ways to fix that problem. And that can turn into a serious issue that's really difficult to solve if you don't get it fixed sooner than later. So if you feel like your shoulder's slipping out of the socket on a regular basis, it's a good idea to come in and have us take a look and see what's going on.